Dr. Nikita. Welcome you in my Pharma online lecture series. So, today we are going to see the different solid dosage forms. Before moving to these dosage forms, we are going to see various advantages and disadvantages of these solid dosage form over other forms. So, first advantage which you can see is an stability. So if you compare solid dosage form with other liquid and semi-solid formulation, they are more stable. Shelf life of these products are more than the liquid and semi-solid dosage forms. Next, you have less incompatibility. Because they are solid in state, they contain no water, and you know that incompatibility reactions are more in liquid state. Okay, incompatibility means the chemical reactions between the ingredients which you have used, and in the solid state these reactions are less as compared to the liquid or semi-solid form. Next you have manufacturing. Now, if you consider the solid dosage form, sometimes they are the simple powders. So, if you have the simple formulations, you have very simple steps for the manufacturing. You may have simply sieving of the powders and mixing and packing. So, the formulation or preparation processes for the solid dosage forms are easy as compared to your liquid and the semi-solid or other gaseous dosage form. Handling of the solid material is also easy as compared to the liquid and the gases. Transportation becomes easy as compared to your liquid and the gaseous dosage forms. The solid powders, they are not as bulky as compared to the liquid dosage form. So it becomes little bit easy as for the transportation, and the cost effectiveness, as we have discussed, that the manufacturing steps sometimes may be less compared to the liquid dosage form. Hence, it becomes the inexpensive manufacturing or the cost effective as compared to the other dosage forms. But what are the disadvantages? First is an ineffective in when you administered through, or you administer maybe through oral route or topical route. But for the oral route, sometimes patient may be unconscious and you may have to select other alternative route. So various solid dosage forms which are given by the oral route, and if the patient is not in the senses or patient is unconscious, then you have to select some other alternative route for the giving medicine. Then again, sometimes the quantity of the drug may be more, or the size of the dosage form may be big. You may have big size tablet, big size capsule, so that becomes little bit difficult for the pediatric patient and the geriatric patient to swallow. Next, you have less quantity and high dose. Less quantity, sometimes the drug may be potent. So if you have less quantity, it becomes difficult for weighing, and if it has more quantity, it becomes difficult in ingestion of that formulation. Next, you have the palatability. So sometimes palatability becomes the problem for the solid dosage form due to unmasking of the taste and the odor. Now, next you have the environmental factor. Now, various drugs are hygroscopic in nature. They absorb the moisture from surrounding. They are deliquescent in nature. So, your drug may have oxidation, reduction, photodegradation problem, and they may be hygroscopic, deliquescent. So you need to have a proper storage for such kind of drug product. Which are the different routes? So various routes you can utilize for the solid dosage form, like powders can be given in the cavity, like nasal cavity, vaginal cavity, rectal cavity. They can be applied topically onto the skin. Then powders can be given orally. Various unit dosage form like tablet, capsule, pills can be given orally. Then uh, sometimes powders are dissolved and they are injected. So these are called as a reconstitution powder, and the liquid is added or water is added, the solution is made and they're injected. So intravenous route is also used. So various routes are used for the administration of the solid dosage form. Next, you have labeling, packaging, and storage. Now, labeling, as per the use of your formulation, you have to label any solid dosage form like powders. If they are external use, you have to label on the formulation that is for external use only. Then you have to label the content of the formulation. You have to mention the strength of the drug which is the present in that particular formulation. Then the way to use of that particular formulation you have to mention onto the label, and storage condition based upon the drug property you have to mention the storage condition. If they are photosensitive, you have to store in amber color bottle or in a dark place. If they are temperature sensitive, then you have to store cold place into the refrigerator. Packaging, so varieties of packaging is possible for the solid dosage form, like tablet capsules are packed into the strip packing, blister packing. Various wide mouth jars are used. Then glass containers are used. uh, Plastic jars are used. So powders can be packed into the paper or foil and they are sealed. Sachets are used. So various packaging ways you can select for the solid dosage form. Examples we will see in detail, which are the different examples of this solid dosage form, and advantages and disadvantages we have seen in the last slide. If you see the solid dosage form, how they are classified. So they are classified based upon the usage, whether they are used internally or the external use. So as you know, internal use means you have to take your formulation through your into your mouth, through your mouth, inside your body, and external use means you have to apply on the external surfaces. So that can be your skin, it can be any of your body cavity, into your eye cavity, then ear cavity. So based upon which area it is used, it is classified as internal use or the external use. Now, next you have the dosage. Okay, how is the dosage? Whether it is a bulk dose or it's a unique dose. So, as the name indicates, bulk dose means the drug is not given in an accurate dosage form. So, the quantity of formulation is supplied in which the drug is distributed, and there is no accuracy for the dosage which you have taken or which you have applied. So various bulk dosage forms are like powders. Then you have unit dosage form. As the name indicates, the drug is given in an individual unit dose. So dose accuracy is maintained in case of the unit dosage form, like tablet and capsule. It mentions 500 grams of drug. That means that particular tablet consists of 500 grams of the drug. So you have a surety and accuracy for the dose which is administered to the patient. So tablet, capsule, pills, pastilles, lozenges, divided powders, these are the example of the unit dosage form. Insufflators are also the example of unit dosage form. Then you have the granules which is supplied in the sachet. So the weighed quantity of granule is packed into the sachet and they are given. That is also example of the unit dosage form. And various example of the bulk dosage form are the powder for external and internal use. So various dusting powders can be the example. Dentrifies is also an example of the bulk dosage form. So powder dosage forms, these are the dosage form where the drug is in fine powder and which are not irritating, and you can be used as an internal or the external use. So advantages and disadvantage of powder dosage form, as we have seen, they are easy to manufacture, Then they are more stable as compared to liquid dosage form. They are convenient to handle for the transport, for packaging. And disadvantages, we see that the if the quantity is less, then weighing is the problem. If quantity is more, ingestion is the problem. Then you have the environmental factor like hydrolysis, oxidation, photodegradation. You have to protect your powder from these factors. First example which we are going to see is the snuff. So as you know, what are the snuffs? This picture, from the picture you can see snuffs are the formulations which are made up of the tobacco leaves. These are the smokeless tobacco leaves which are pulverized or finely grounded, and they are inhaled into the nasal cavity, or they are also rubbed onto the teeth and the gums. Okay, so they are used as the bronchodilator nasal decongestion in action. Now, problem associated with the snuff is they may have addiction liability and they may be carcinogenic in nature. You can see the container closure for this. Leaves are powdered and are filled into the metallic containers. They are also packed into the small packets or the small bag. The pinch of the powder you have to inhale into the nose cavity, and since 15th century the snuffs are used. The next solid dosage form is dentrifices. What are the dentrifices? These are basically solid powders which you use for brushing your teeth or cleaning your mouth. So these are the powders which you use for cleaning of your mouth cavity. They contain some detergent, soap, humectant, and sometimes some flavoring agent and sweetening agent. They are used for oral hygiene, to remove stain from your teeth, to remove any food debris, to keep your mouth clean. Dry form is powder and the wet form of the dentrifices is paste, and you can use it with or without brush. Okay, so here you can see the picture for the dentrifices. So how to prepare it? The powders which are used, you have to sieve the powder, mix them together, and you have to pack into the final container. So shifter top container also used, or the glass jars are also used for the preparation of the dentrifices, even though they are used into the mouth cavity for cleaning, but these are not for the swallowing. So this direction you have to write that not to swallow and only for external use. Okay, so another dosage form which you have is that dusting powder. These are meant for the external application to skin, which is very fine, to avoid the local irritation. So we have used dusting powders, and talc or kaolin is used as a base for the dusting powder, and they are very fine, so they should not cause irritation when you apply to the skin. You can use as antiseptic, antipruritic, then absorbent, antiperspirant. And the preparation is also simple, that you have to sieve all the ingredients, powder ingredients, you have to mix them properly, and you have to pack into the final container. The plastic container is preferred. Shifted top plastic container is preferred for the dusting powder. Dusting powders, these are also of two types: surgical dusting powder and medical dusting powder. So, medical dusting powders you use for the skin condition, superficial skin condition, which we can say that antiperspirant, antipruritic. But surgical dusting powders are used for the cuts or wounds, or any surgery wound. So these surgical dusting powders should be sterile. They should be free from microorganisms and pathogens, so that they should not lead to any infection. So these are the dusting powders, and you have to mention that for external use only. So these are not for internal use, and you have to apply only at the affected area. This is one of the formulation I have taken as in bulk powder formulation. You can see the label composition, that is how much is the percentage of the drug. Then direction for use: to be used as a dusting powder for affected area, affected part of the body. Storage, they have mentioned store in cool dry place, and the per amount which they have packed they have mentioned. And in the blue they have written for external use only, that is the main direction with a shifter top container, and you can spread onto the affected part of your body spread. Now you see the bulk powder formulation, there is no dose accuracy. Now you do not measure how much powder you have spread onto the skin and how much a drug is there in that powder which you have spread on. That's why drug is mentioned in terms of the percentage. It is not mentioned how much drug, exact quantity of a drug they have added. Now, next you have is the divided powders. So, as the name indicates, divided powders means the individual dose is divided in a individual packet. Okay, so this is the example of unit dosage form divided powders. So you can see this is the powder which is then packed into the individual packet. Divided powders, these are for the oral administration. Lactose may be used as a diluent for preparation. So drug is mixed with this diluent and they are packed into the final packages. Now you have two types, simple powder and the compound powder. Simple means only one ingredient pack, then it is called as the simple powder. And if you mix more than two ingredients, then it is called as the compound powders. Now the dose for this divided powder is up to 100 to 120 milligram, and you have to write the direction whether you have to mix in water or any other suitable vehicle to take that powder. So the preparation includes sieving of the powders, mixing of the powder, and then final packing into the foil or paper as an individual dose. Then this individual dose is placed into the plastic box. In directions, you have to write the dose of each packet, then how to store. Next, you have insufflations. The term insufflation means to blow. So the powders are blown into the body cavity with a metered dose device. Okay. So this metered dose device help to deliver the measured quantity of powder. That's why they're called as the unit dose, because the dose accuracy you can measure. In this diagram, you can see the metered dose device. You have the metered device. So the powder is filled, but this device controls how much powder to deliver. And the another diagram, you can see the capsules are there. So this capsule is containing the measured quantity of powder which you are putting into this device, and then you are blowing it into the particular body cavity. They are used to deliver the steroid, antihistaminics, and the decongestant. Insufflations are also surgical use when any surgical preparations or any surgical operations are to be performed. The some gases or some powders are blown into that particular area where the operation is to be done. So key points for the preparation of solid dosage forms. Basically, what is the route of administration? What are the advantage and disadvantage of these formulations? Labeling, direction, packaging, container closures, storage conditions, and various examples. Kindly like, share, subscribe my channel, and keep watching my channel for more information. Thank you very much.